This video will provide you with an understanding of the therapies to treat sleep apnea, as well as address the various factors that may affect your quality of sleep. What is CPAP therapy? CPAP is an acronym that stands for Continuous Positive Airway Pressure. Your CPAP machine delivers prescribed amounts of pressurized air, and only a physician can determine the pressure amount needed. The air pressure is measured in centimeters of water. The air acts as a splint that keeps the throat from collapsing. This prevents the soft palate, uvula, and tongue from shifting into the airway. It reduces the vibration that creates the snoring sound. It may relieve swelling within the nose and clear out mucus from along the airway. By supporting the airway, breathing normalizes and sleep quality improves as fragmented sleep resolves. Oxygen levels can be maintained. Your CPAP should be used during all naps. What is BiPAP therapy? BiPAP is an acronym that stands for Bilevel Positive Airway Pressure. It is used to treat both OSA and CSA by delivering two alternating pressures. BiPAP is a method of breathing support that is often used to treat CSA, a condition that occurs when the brain doesn't transmit the proper signals to your breathing muscles. It can be associated with prior stroke, congestive heart failure, and opioid use. It may also be used in more severe obstructive sleep apnea, especially if mixed apnea events are present, suggesting a component of CSA. It can be beneficial for patients who cannot tolerate CPAP therapy, especially those who complain that it is difficult to breathe out against the pressure. This is more likely to occur at higher pressures when these are required to keep the airway open. BiPAP therapy may help to improve the compliance of those who are struggling with CPAP therapy. The key distinguishing feature of BiPAP therapy is that the pressurized air is delivered at two alternating levels. The inspiratory pressure, or IPAP, is higher and supports a breath as it is taken in. Conversely, the expiratory pressure, or EPAP, is a lower pressure that allows you to comfortably breathe out. These pressures are preset based on a prescription provided by your sleep doctor. Beyond these standard settings, there are a few other variations that are available. Bilevel ST includes the timed delivery of a breath if breathing pauses occur. These pauses are often present in CSA, which is central sleep apnea. Auto adaptive servoventilation, or ASV, includes more sophisticated settings that vary the timing, length, and volume of the breaths that are delivered. What are desensitization practices? These are steps that you can take to help acclimate yourself faster to CPAP therapy. Consistent nightly usage is recommended. In addition, many have found it useful to practice using therapy at times other than at night. If you're experiencing difficulty with tolerating therapy, the following practices are recommended. Try using your CPAP or BiPAP machine at home while awake for 1 hour each day. Attach to your CPAP and practice breathing through the mask for 1 hour while watching television, reading, or performing a sedentary activity. Use while napping. Increase your daytime usage by 1 hour each day or as tolerated. When you are able to tolerate therapy for 4 or more hours continuously, you no longer need to practice. Expect to work with your CPAP and BiPAP unit. It is important to try to relax when beginning CPAP and BiPAP therapy. Inhalation and exhalation should occur through the nose only. If you are unable to consistently breathe this way, do not panic or lose hope. There are other types of masks which allow you to breathe through your nose and/or your mouth. Don't give up after a few attempts. Some patients need 3 to 4 weeks, or sometimes longer, to become accustomed to CPAP and BiPAP therapy. CPAP and BiPAP tolerance recommendations. Some patients may have difficulty tolerating CPAP for many different reasons, some of which are discussed below. A lack of humidification. In general, CPAP tends to dry out the air, therefore extra humidification is usually required. A heated humidifier is available to help add moisture or humidity to the air moving through the breathing circuit. Temperature. The air coming from the CPAP BiPAP can be adjusted on the newer model CPAPs and BiPAPs. Nasal allergies. Sometimes nasal allergies can be exacerbated by CPAP therapy. Any known allergens in the room should be removed. Frequent vacuuming may be required. Elimination of animals from the bedroom may be helpful. Ensure that CPAP filters are changed frequently. Use only distilled water in the humidifier and replace it daily. An oral antihistamine or prescription nasal spray may be prescribed by your doctor. Nasal dryness, use a nasal saline spray before sleep at night. Nasal irritation, consider using a small amount of a water-based lubricant in your nostrils. An increase in your weight will make your snoring and sleep-related breathing irregularities worse, and reducing your weight is likely to improve your condition. It is important that you try to reach an ideal body weight and maintain it. Reducing your weight and being more physically active will also decrease the risk of developing cardiovascular disease. Alcohol intake. Alcohol is a potent sedative that can induce irregular breathing apneas in healthy people. Alcohol will not only increase the number of apneas, but will make them longer and reduce the oxygen level in the blood. It is very important that alcohol be avoided within 4 to 6 hours before bedtime. Other sedative medications. Sedative medications include sleeping pills, antihistamines, anti-allergy pills, some cold medications, some epilepsy drugs, and other medications for psychiatric conditions. As with alcohol, sedative medications are likely to worsen your breathing irregularities. Consult your physician before taking sedative medications. Definitely do not use any sedative medication with alcohol, as the effects will be potentiated several times. Sleep deprivation. Try to maintain a regular schedule with a full 8 hours of sleeping time. Any loss of sleep will increase your need for sleep the next night, and your breathing irregularities are likely to become more severe. Sleep position. Sleeping on your back is likely to increase breathing irregularities, as your tongue tends to obstruct the back of your throat, resulting in a decrease in the size of the airway. Bed position. Elevate the head of the bed 4 to 6 inches to take some of the pressure off the diaphragm. This will ease breathing during sleep. Colds and allergies. Any infection affecting your nasal passages or throat will cause swelling and tend to worsen breathing irregularities. Meals. Large meals should be avoided at least 2 hours before bedtime. A large meal will increase the pressure on the diaphragm and worsen breathing. It may also predispose you to regurgitation of the stomach contents during sleep, which will provoke irritation of the airway. Smoking. Nicotine and other substances contained in cigarettes, when inhaled, will provoke irritation of the upper airway and worsen breathing irregularities. Sleep hygiene tips. Falling asleep. If you have trouble getting to sleep, try getting out of bed and doing something else. Preferably move to another room and return to bed only when sleepy. Establish a routine for an hour or so each night before bedtime, such as reading, taking a warm bath, light exercise, such as stretching or just relaxing quietly. Avoid too much mental stimulation during the hour prior to bedtime. Stress. Almost everyone experiences an occasional night of lost or disturbed sleep. This can be caused by stress. Try the above suggestions for falling asleep. Naps. If you are having trouble falling asleep at night, avoid naps in the early afternoon or evening. Getting up. No matter how poorly you have slept, always set your alarm to arise at the same time each morning. Exercise. Regular exercise can be an effective aid to sleep. It releases energy and eases mental tensions. Do not exercise strenuously just before bedtime. Noises. People who sleep near excessive noise should try heavy curtains in their bedrooms or earplugs to help block the outside noise. Hunger. A light snack or warm milk seems to help some people get to sleep. Always avoid coffee, tea, and cola near bedtime. Also avoid heavy meals 2 hours before bedtime. Sleeping patterns. Everyone has a unique sleeping pattern. Some adults need 10 hours of sleep a night, others need only 6. Many people function best at 8 hours of sleep per night. Your requirement for sleep is unique, and what is effective for others may not be effective for you. Find your individual sleep need and maintain a consistent schedule for sleeping. Symptom of medical problems. Sleeping problems may signal a medical condition such as anxiety, depression, or other disorder. It is important to get a proper diagnosis and treatment of the underlying cause of a chronic sleep disorder. Medications and alcohol. An occasional sleeping pill may be of some benefit, but chronic use of sleeping pills may actually hinder good sleep. Sleeping medication should be used with caution for the short-term management of a sleep complaint and only upon the advice of a physician. Do not increase the dosage yourself. If you feel that the medication is losing its effect, report this to your doctor. Although alcohol may help to induce sleep, the chronic use of larger quantities of alcohol causes disturbed sleep and dependency.